Hi, my name is Marshall Shore, and that is Marshallshore. And I am the project manager for the LGBTS History Project, which is a collaboration between the Phoenix Pride and ASU libraries as we work together to start documenting Arizona's LGBTQ history. We are here at the Heard Museum on December 2nd of 2020. And I'm excited that we're doing these interviews because it really shows a small slice of Arizona history. I myself came from Indiana, a small little farm town in pretty much the middle of nowhere, and went off to college and found a whole group of friends there. Now, as I was leaving to go on for my master's, you saw that community start to crumble. And I found out years later that HIV/AIDS pretty much wiped out that entire population of those folks I knew, with, as far as I know, only one other survivor out of that little community. And so that's why I'm excited to do this, so that we can start to show that progression of, at one point, HIV/AIDS was considered to be a death sentence. And now it is so dramatically changed from that. Now, there is still a lot of stigma, as you'll hear about from some of the other interviewees. But I also love the fact that so many people found a strength with that. When you'll hear from the Ripple Phoenix folks about how they needed services that weren't available, so they created that for other folks. With Noah, I mean, him using it as almost kind of like the canary in the cave, and allowing him to be like, oh, it helped him find his way. Then you have Glenn, who from Aunt Rita's did a great interview and really kind of couched the fact that we're sitting here in Phoenix, and Phoenix has become one of the few cities in the country that has said, yes, we will commit to being a fast-track city, which means by 2030, their goal is to eradicate HIV/AIDS here. And so that's really why we're doing this, as a way to start documenting the stories on that way to that solution and ending the crisis once and for all. All right, so if you will both tell us your names.
I'm Jeremy Bright.
Jason Jones.
Jeremy Bright.
Jason Jones.
My name is Noah Altman. NoahAltman.
My name's Andrew, and last name is Rascon. It's Rascon.
My name is Victor Avila. It's VACTORAVILA.
Glenn Spencer, GLENSPENCER.
Dr. Tennis Vanek, THANESVANIG.
We've been together for 6.5 years now, and very early on in our relationship, I was diagnosed HIV positive.
It's 7 years.
Is it?
Yeah.
My bad. We've been together for 7 years. And like I said, early on in our relationship, I was diagnosed HIV positive, and Jeremy isn't and wasn't. But it was this was 2012, so it was the very, very early days of PrEP, and granted, HIV medications you could live a long, productive life at that point, but it was still a scary time for us, where we're just in a brand new relationship, and the early part of our relationship, I wasn't sure if, based on my exposure, if he was going to test HIV positive. So we had to deal with that very, very early on in our relationship.
I am HIV positive. So back when I moved here in 2010, I didn't know necessarily what I wanted to do. I knew I wanted to go to school and work and figure life out. So I had about a month here, and I started volunteering at which basically is Phoenix Pride now, but it was called One Voice Community Center then. And I volunteered with them, and they were offering free HIV testing. I had not been tested before, so I decided, hey, you know, I'm new to the city, might as well find out and have a clean slate and start off fresh and new. So my first HIV test turned out to be reactive, and I got my positive diagnosis back in 2010.
I have a lot of personal connections to it. I mean, I had from my own experiences to family, to friends, but I think the biggest part is I had an uncle who passed away of AIDS in the early 90s, and growing up, it was cancer. No one acknowledged the fact that it was AIDS. And so it wasn't until really the last 4 years, like 4 years ago, where I finally got the real truth on how my uncle passed. And I think it really helped motivate me to want to have a voice for people who couldn't. So this is why I'm here. But I also had my own personal experiences where I didn't have the resources available for me. I didn't have a program like the T-Phoenix to go and learn from. And so now it's my time to be able to provide that for our younger youth.
So I tested positive for AIDS in 2002. I was living in Flagstaff at the time, and I just moved back to Arizona from Portland, Oregon. And I was extremely sick, and went to the county health department in Flagstaff and discovered my HIV diagnosis. And thereafter, over the next 5-6 months, discovered all of the various opportunistic infections that I also had, which explained why I felt like shit, and had difficulty breathing and walking and even doing the most basic things in life.
I have had friends who are HIV positive. I have been in the community, and I've seen people go through, just terrible things. But now, formerly I worked for Aunt Rita's Foundation as well, who is dedicated to the elimination of AIDS and HIV. And I learned so much through my time at Aunt Rita's and working with all the volunteers in the community that support Aunt Rita's Foundation. And I just learned a lot. So personally, I think it's something that we need to continue spreading education about and letting people know what the disease really is about and how it's changed from the 80s to where we are now.
I'm a physician. I treat mainly people with HIV and AIDS or anything that AIDS-related services, such as PrEP. I'm a medical director of Spectrum Medical. It started back when I was in medical school. I was in Thailand actually, and I saw my first HIV patient who was a Pan Am flight attendant, and he got some, we know it's really bad infection that didn't have a name, and he was in the isolation room with a little tiny glass window, and we all cannot touch him. We were just looking at him from outside. And then when I came here to the US to do residency, I saw my first HIV patients in 1988, and he was an MIT student, and I went in to talk to him every day, and he was in and out of the hospital a few times, and he finally passed away.
I understand some of you don't recognize me. My name is Clayton McKee. I used to wear white V-necks. I realize it's a very big difference. So this is the incarnation of me now. The reason I was actually very surprised and honored when Marshall asked me to participate in this because I come from Missouri before I moved to Phoenix, and I come from a land of no information in the 80s and 90s in reference to this specific topic. The flyover states didn't get a lot of it. It was the Bible Belt. We didn't get a lot of information. We were told a lot was going on. Really, the biggest thing that I remember growing up was when Rock Hudson died, and that's what made it legitimate to the people in the Midwest who didn't know what was going on in bigger cities. So with that, I wanted to run through a few things that were highlights, since we're talking about the 80s and the 90s. I was going to give you some highlights that I printed offline. It's amazing the internet has actual information. You don't have to believe everything you read, but I think this one from AIDS.gov is legitimate. Just to give us an idea of some of the milestones that we went through in the 80s and 90s, and then we'll go through some of the milestones that these kids went through, going through all of that. June 5th of 81, the U.S. Centers of Disease Control and Prevention published the first cases of describing a rare lung infection found in gay men. That was the first time that it was actually even talked about at all, and they didn't even have a name for it back then. January 4th of 82, the Gay Men's Health Crisis, the first community-based AIDS service provider, was founded in New York. Followed by, in September of 82, the CDC used the term AIDS for the very first time. That's how long ago that's been. 83, January 1st, Ward 86 in San Francisco General Hospital was established, the first dedicated outpatient AIDS clinic. Followed by, in January of 83, January 7th, the CDC reports AIDS cases in females for the first time. Skip all the way to 85, which was Ryan White, and then you get a teenager who contracted AIDS through contaminated blood products used to treat his hemophilia. That's when he is diagnosed with contracting it. September 17th, 85, so we've gone 4 years. The first time President Ronald Reagan mentioned AIDS at all, and then calls it a top priority, defending his administration against the criticisms that they had already been given for the research and inadequate responses. Flash forward to 86. October of 86 is when the Surgeon General reported on AIDS, the report to make it clear that HIV could not be spread casually, and then called for a lot of education campaigns, including sex educations in schools, and increased use of condoms and voluntary testing. 87 is when, February 4th, 87 is when Liberace passed away from complications of AIDS. President Reagan, in May 31st of 87, makes his first public speech about AIDS. We went 6 years before anything was actually publicly done from any administration with regards to that. Flashing forward to 88, Sylvester, singer, performer Sylvester James Jr., an openly gay African-American entertainer, he passed away at 41 years old, and that was in 88. Followed by Max Robinson, the first African-American network news anchor to be diagnosed. He also died of AIDS at 49. In 89, ending the 80s, August of 89, the CDC reported for the first time that AIDS cases had reached 100,000 people. Only going through a couple of more as we get into the 90s. November of 91 is when Magic Johnson announced that he was positive. And then November 24th of 91 is when Freddie Mercury passed away. So those are just some of the big milestones in the earlier days to think back of how long ago it's been since all of this has happened. And obviously we just had a Freddie Mercury movie very recently about his life and what he did. As I mentioned, when I was growing up in Missouri, I didn't know much about all that was going on or what fight had been happening prior to me coming out, which wasn't until the spring, how old was I? Spring of 94, so I would have been 24 years old when I had already moved to Phoenix and met all of these wonderful people. I like to call what I learned when I moved here trial by fire, because I fell into a little bar called Winks, and I met a great group of people, and Tish Tanner welcomed me warmly into a family that included all of these people, and I joined a fight already in progress. They were already raising money, doing bake sales, doing shows and events, and I just pushed play for every single one of these people from behind. Well, maybe not for Quentin this much, but definitely for Davina, Pussy, and for Diane, I have pushed play for all of them, including Claudia sitting in our audience as well. So I got an education very, very quickly from these people and learned really quick that it was much bigger than people in the flyover states were ever led to believe, and then from there it grew and grew, and the internet was developed for more than just chat rooms, and everybody got more information, and it just became bigger and bigger. So finally, the education got to them. And to that, I want to introduce the other 4 people up here on the stage because they have been instrumental in bringing the fight and raising money and doing a lot to get us to where we are today in this gay community of ours. In no uncertain order, I will start with Daniel Thole here on the end. This is Diane Daniels, for those of you who might not know. Seated next to Diane is Kevin McSweeney, also known as Pussy. Love it. I think one of the first people I actually encountered in this town, and the first person to put me on stage at the 307, sitting right there next to Puss, is Teddy Rodriguez, also known as Davina Ross. And certainly, last but not least, somebody who I actually never got to see perform much because you had actually stepped out of the dancer role from Miss Ebony and all of that, but I finally got to town. But DJ Q, also known as Quentin Jenkins, is at the... I do believe that the mics all work. We did not do a sound check with all of those, so turn those on and let's see what we got. Let's go down the line. We'll start at the end. Start with Quentin. Who are you? When did you get here? How long have you been in Arizona or Phoenix? And your entertainment history in the area.
The parents were, my father was a military man, and we came to Phoenix in 1968 and moved to Paradise Valley in 1970. So I came through the Northeast Valley here. Moving a little further forward, I started to work with Sammy Sedita and Tony Bartoli, and of course, Good Lady Ebony there at the legendary Casa de Roma in around 1977. So I was a pip for Ebony's act of Gladys Knight and the Pips, and we, with a cast of Joanne, Tish Tanner came a little bit later, but we had beautiful souls like Woo Woo, Charlene Champagne, which is one of the Pips, John Thomas, who then graduated into Charlene Champagne. Sissy Goldberg is another name you all might remember locally. She was with Brett Ball's Bottoms Up. She's a comedian and MC extraordinaire. So they were the cast and members of the Musula is another one. But the cast of the Casa de Roma was a showroom that was really legendary for its time because it was really busy 7 nights a week. And so I graduated from that to starting to do my own shows and starting to do my own things. I became a model with Ford Casablancas, Ford and Casablancas, Jean Casablancas Elite first, and then Eileen Ford, which was represented by Ford Robert Black, which still exists today, and springboard into my international life, and came all the way back around full circle as now a new artistic iteration as DJ Nathan Quinn, which I still perpetuate today. So that's a bit about my history from Phoenix, a little bit around the world in a few different ways, and then now back here in the Valley as recently as 2 years ago when the husband and I, decided to take up residency in Sedona, to split the year between Barcelona and Sedona. So there you have it.
Well, all right, next shot. Davina?
Well, all right. Well, I am Teddy Rodriguez, aka Davina Ross. I moved here as a result. I am originally from Brooklyn, New York, born and raised in New York, and my mother had a very nasty car accident on the LIE, affectionately known as the Long Island Expressway. And so my mom basically told my father, "We're getting out of here. We're going to a warmer climate," and that is what brought us out here. So we moved out here in 1981 from New York, so that was quite the culture shock. Definitely coming from that particular environment coming over here. I came out to my parents in 1984 and started doing drag the same year. That's why I tell everybody, I did double whammy on my folks, baby. All of a sudden they said, I'm not only coming out, but I want to do this thing called drag. and my mother was just like, what? Are you crazy, boy? That's exactly what she told me. Are you crazy, boy? That's what she told me. But like anything else, when you know that it's right for you, you just do it, and you do everything you can to make it happen. So I started back in a bar on 24th Street and Osborne, Thomas, called Shaboo's, for those of you that go back that far, in 1984. Hard to believe this past year, celebrating 35 years doing drag. It's so crazy, but it really is something that I love, and being an entertainer in the community, working in different bars, doing different gigs, basically loving what I do, and really am very thankful that I'm still here. And what I love about being part of this, and I just want to thank Marshall for asking me to be a part of this as well, is that I think this is a great reflection back to kind of see where we've come from and how far we've come along, because we've definitely, and I'm not going to steal any thunder from everybody, but I'm sure we'll get into it. Definitely the scene today is far different than what it was back in 1984 when I came out. And I think that I'm very grateful to see that a lot of the things I never thought I'd ever see come to pass has come to pass. Everything from a show like Will and Grace getting mainstream acceptance to just even the company that I work for, which is Bank of America, that's what I do full-time, I'm a project manager for them. The fact that they have not only embraced diversity, but they actually promote it. And it is considered now to be an HR issue, as they like to call it in corporate speak. If you don't respect everybody and allow everybody to live their authentic life and be their authentic self, and which I think is amazing. So I'm very, very proud to be part of that, and as they say, still happy to be dancing and twirling for dollars, y'all.
That's my roots.
Hello.
There you go.
And I can attest, I was there the first night Davina got there, so I was sitting there waiting. My name is Kevin McSweeney. I was born and raised in Flagstaff, Arizona, which it still is, but back then was even a smaller town. It was a great place to grow up. I was really shy as a child, and in high school I got introduced to choir and drama, and that's when I kind of came out of my shell, so to speak. And I had a great teacher that, and I'm still in contact with her today. She was kind of saying, you know, it's okay to be who you want to be. You can be the crazy one. You can be the different one. You can be like the, you know, the Paul Lynn or whatever. You don't have to conform. And so between my junior and senior year, I came to Phoenix with a friend, and we went to cross the Jerome on 16th Street. And I was only 17. And saw my first drag show with some of the people Quentin talked about, and I was like, oh my god, this is kind of like what I've been thinking about, because I never knew. I had stayed in my bedroom as a little boy lip syncing to Bette Midler and Boogie Woogie Bugle Boy and the Andrews Sisters and Dolly Parton, but I never knew that people did that and did that for a living.
Diane Daniels. So yes, you're absolutely right. Like you, Midwest. Minnesota is where I grew up. Cold, hell, horrible. I want to say I graduated in 1980, and I always kind of knew I was gay. So my parents found out in an unusual way, just because the Minneapolis police detectives called them to let them know that they found my wallet at the gay bar downtown. The gay 90s, yeah, so. Oops. So yeah, that was a good time. Just, you know, have fun.
What was the story you used to get out of that one?
I didn't. I said, oh yeah, I'm gay.
Okay.
And then they were like, okay, so therapy. Okay. Yeah, so we went through a little bit of that, but it was fine. They ended up being very supportive. I started doing drag in '81. Someone took me to a drag show, and I'm like, oh, now that looks like a lot of fun. Like, I'm gonna do that. That just looks like fun. And kind of like was, I ended up doing a contest at the K90s and won, you know, and then you got to perform on the weekend, right? With all the big wigs. And yeah, the big wigs. Until you do a number, like, or impersonate someone that the regulars do, then you get blackballed, just so you know, back then. So I kind of had to move to a different bar after that. So, you know, life is fun. But back then, yeah, in the early 80s, we didn't know a lot about HIV and AIDS. Just because the Midwest, like you said, we just didn't. We thought, oh, yeah, there was a case here, a case there, but we'll talk more about that. Anyway, I moved to Texas after that, Beaumont. I know, right? For 3 years, I graduated nursing school, and I'm an RN. So I went down there for a job. Well, very small town, but a lot of drag for a small town. They had 2 gay bars. Nothing else was open at night in that town. 2 gay bars. That was it. So yeah, lots of drag, good times, lots of cocktails, that's fun. So doing drag there and in Houston, and eventually, you know, I had to get out of Beaumont, good God. I ended up moving here in '89. So from '86 to '89 I was there, and I moved here in '89. And it was kind of tough getting in because Penelope Bouquet, who we talked about earlier, she was sometimes a little tough to crack. And yeah. So I had to crack through her, and I had to crack through Tish a little bit, because, you know, I was a seasoned performer, and they knew that, you know, but you're new here, okay? So, actually the first place I performed, and I don't know if you guys ever did, but was at the bathhouse on Durango, when they still had a bar. Yeah, remember? So, yeah. On the curve, yeah. So they had a bar. That was the very first place I performed. Then I got caught up with the Wings crowd, which everybody knows about Wings, I think. So, yeah, I've kind of been doing it ever since. I refuse to say I've retired, even though I don't do it a whole lot anymore. Once or twice a year, if I'm lucky. Because nobody asks me. Just kidding. No pressure. No pressure.
We're not entering the shade portion of today's
Anyway, no, I'm just kidding. Yeah, so. It's all good. I'm totally fine with that. So, anyway, that's kind of how I got here. I don't want to go on forever, so.
How long you been doing drag, girl?
Drag since '81, so how long is that?
39 years.
39, yeah.
Wow.
That's a long time.
Just slightly older than
Slapping it up.
what's her name? What's the other one? Your cohort? Why can't I think of her
Oh,
name?
that's my daughter too, Julie.
Julie is
Craig.
your daughter?
She's my drag daughter.
Julie
yeah.
Craig is your daughter. I thought she was older.
She is older than me.
Okay.
It's just when I gave birth to her, the wrinkles were on her face.
So, and this is open up to all of you. And I totally understand when asking this question, it could be very personal, it could be very emotional, and go into whatever it is you want to. Do you recall your first interaction, be it on stage or personal with someone else, whatever? What was your first interaction with regards to HIV or AIDS? Your first time that you may have had any interaction with it?
Well, so the context that I did mention in a bit of my history was what I did at the Casa de Roma was I came into choreograph as one of the pips and ended up being the guy who, as male lead in the gay and drag world, for shows. Would bring in other dancers because I had professional dance training, so I would go around to all of the bars and bring the male dance shows for different men of Playgirl, the men of Chippendales, to not only the gay community, but to the community at large, Scottsdale, Tempe, Mesa, wherever these businesses, even on the west side in Glendale. So I had a good purview on the nightlife through that lens and sort of behind the scenes. And so when I got to Tommy's Copa West, there was a bar called Tommy's Copa West, just a few buildings down. The building is still there, but it's some other purpose. It's repurposed now, it's something else, on the same side of the street that Charlie's is. And it was called Tommy's Copa West. Tommy Casella owned gas stations and was a well-to-do guy and owned Tommy's Copa West. And Tommy asked me to do a benefit for, as an African-American male, the people who were dying in Africa. And so this was the context by which it was meaningful to me, because then, of course, like Puss says, there was no internet and everything, and I started to read, and I started to do a little deeper dive, and it was a marginalized situation where there was really little funding, and it was a pandemic at that point because, hundreds of thousands or tens of thousands of people were expiring with little vision about what it really was and how to cure it, and different hypotheses about how it occurred, and etc. So as an African-American male being approached by a straight bar owner to do something meaningful, I brought together the men Playgirl, which is funny, to the women as the clientele there. And we raised virtually $6,000 that night from not only Tommy giving a large chunk of it, but from the patrons, the women, and gave it to the AIDS organization. At that time, Kirk Baxter was, and is continuing in his neophyte stages. Mr. Baxter is a legendary HIV and AIDS advocate here in the Valley. But he was the person who I turned the money over to say, get it to the right place. So that was the context that I came into the HIV and AIDS awareness. And then because I was choreographing and I was the producer of shows, I also had a show at Sammy's Steakhouse with Bill Ranke, Sammy Sedita. It was the new iteration that after the Casa de Roma closed, and some of them broke off and went to Harpo's. The other ones like Lady Ebony, Joanne, and Goldie O'Brien were some of our cast members, and we had male and female. We did a full variety show. So we had, it was a full production show, costuming, etc. We had Bill Ranke and those guys, and the other person that I want to mention in the context of this is the legendary Dale Williams and the Connection. The Connection was known as a stand-up cruise bar, Levi Leather Bar. It was Connection, Bill Drew, and then ultimately Taylor's, the restaurant that opened after that, had a drag show in it. And so in those contexts and in those venues, Shamus was another place that Chuck, and then the early days before BS West was BS West, it was something, a piano bar in Scottsdale, and they had fundraisers for HIV and AIDS causes. And then the last part of this statement I'll offer up is, of course, Albert and Donald over at Winks, who were at least a home to Aunt Rita's. And I don't know if they were the inception of Aunt Rita's, but I know that they were a home to Aunt Rita's. So these were the clubs and the context by which club owners, interestingly enough, and because Ebony had such a statewide purview, being from Chicago and being the traveling one, we would go down to Tucson to the Fine Line, to Joshua Tree Back Pocket, to the clubs that were there. IBTs was still existing, was then, and do fundraisers because Ebony was a nurse. and from what I understand, came to Arizona from Chicago and was a part of, with Dr. Bob, the origins of the VD clinic in downtown Phoenix. So through interesting connection, I was involved with a lot of those different organizations, different clubs, because I was bringing meaningful content to the clubs. But as a male, and then as an African-American male who had visibility in the straight community and the gay community, there was a bit of interesting cross-pollination. But the first context I had with it was around me being an African-American male and the purview of people in dire circumstances in Africa. Because like Pussy LaHoot says, we didn't have a lot of context locally about what was going on. We heard about people, and there were these philanthropic efforts to affect people in New York and Los Angeles, but there was very little context. I think Woo Woo, who was the preeminent Diana Ross before Davina Ross, and the cast member at the Casa de Roma, passed away early, was a dark moment in our community, because Woo Woo was larger than life, a seamstress, incapable, a Native American, but would come the day that Ross would come out with something, she that afternoon would go to his SAS fabric store and whip up something and come back to the club and be that and debut that, because then the shows you had to be a real character. You just couldn't be a individual personality. You had to be either the Liza or the Diana Ross or the Marilyn Monroe or the Liza Minnelli or whoever. You know, you had to have a famous impersonator. There were female impersonators there. And so Woo Woo came, and she was Ross and wooed people, and you know, when she passed away, that was another early context I had with the virus.
I would probably say that when I first came out in 1984, there was rumblings about this disease, but it was never hardcore, like Quentin was saying, concrete, to where this was really serious, and this was really an ongoing epidemic. But one of the things that I started noticing, and I'm sure all of us here on this panel would agree, as you know, when you're out and about, you're performing, you see people out and about, and you see them, and especially what I call the beautiful boys and the beautiful girls, the power couples, then all of a sudden, you wouldn't see them for an extended period of time. And you would start asking, hey, have you seen Bobby? Have you seen Troy? I haven't seen him for a long time. And then that's when you would really, this is where it would really hit home with me, was when a lot of times people wouldn't even want to say the word AIDS. They would just say, well, do you know Bobby's sick, right? You're not going to be seeing him anytime soon. And you would be like, whoa, okay. And then, as we all know, in this bar life, things can have a little bit of a distorted kind of perception, because especially if they're known as a power couple, and they seem to have everything, the marriage, the home, the 2.3 dogs, and the whole 9 yards. You'd be like, and they're both gorgeous, and out in the bar, just having a great time. Next thing you know, you hear about one, and then you hear about the other. That's when it really started hitting home for me. But I would really probably say the really life-changing moment for me was, as definitely all of us will attest to, when you start out in this entertainment industry, if you bond with a club owner, they become, especially if they believe in you and they believe in your talent, you really bond with them. And at Shamoose, I became very close to Bobby Locke and Dean Jones, who owned the bar at the time. And I had no idea until they came up and just told me straight out, well, you know that we were both HIV positive, right? And I was like, oh, I was just a young, I was barely 19 years old. And Dean was the first one to go. and I still remember like it was yesterday when I had to attend his funeral. That's when I knew, this is serious, you guys. This is serious. This is when people would start talking about the different fundraisers the community was going to, it really brought it home to me on a personal level. And that's what inspired me to get involved. And I will tell you that as a youngin at that time, I didn't have the knowledge to try to coordinate or put on an event. But I will tell you, anytime that they asked me, I would pitch in and do it. Because that's, you do what you can do, knowing what you know at the time, the best that you know how to do it. You know, that's the best way I can describe it. But I will tell you that since when that hit home with me, I realized that this is much bigger than what we thought it would be. Miss Ebony, being my drag mother, being a nurse, also brought it home for me as far as in her nursing line, she would talk to me about, yeah, I know about so-and-so because he's my patient at the hospital. I see him every day, and she was in respiratory therapy at that time. And she treated a lot of our brothers and sisters that were affected with the disease. And she would tell me, she said, bitch, this is no joke. I know that a lot of times, at the bar, we're, woo, be happy, free, gay. And there's nothing wrong with that, mind you. But at that time, it really hits home for me. That's why I was telling Quentin earlier that in a lot of ways, in the 80s especially, I had come out, it was like as they say, a whole new world. And it was fabulous. But there was that side of it that was really serious, that you had to stop and think that, oh my gosh. So it was an interesting dichotomy, if you really look at it from both sides of you, that if you live in the AIDS and you were young, and it's, of course, all those things when you come out, and it's brand new and fun and exciting, but by the same token, during that time period, there was a lot of paranoia around AIDS. And especially because there wasn't a lot of education at that time to talk about it and understand the true. So of course, as we all know, the paranoia is fueled by what they think they've heard, they don't know, and what they think they know. So it was a very interesting time to live at that time.
Well, and Ted, I was just saying too, as people of color, men of color, in our particular communities, it was not only was in the larger community, there's some general misunderstanding and confusion, but as a man of color, they, even today, particularly the men, African American women, probably are a lot more open about it, but the men, due to stereotypical approach to manhood in their culture, could never, it was terrifying. It was just terrifying. And you just didn't, and you just don't. And you deal with whatever you can through the lens of your manhood. And so, it was even a little more horrible due to cultural pressures. Let's put it that way.
The hood, I realize there's a common thread with the same bars, the same people you work with, but again, pose the same question.
Yeah, I can't tell you the first time I remember doing a benefit. Like, I remember a few things that stuck out. I remember one time going, while I was working at Shamu, so it was early, I still had my Pinto, and I went to Flagstaff to visit a friend that I went to high school with. We were besties, we had done everything together, and we were having, we had like some Circle K sodas, and I said, well, here, have a drink of my soda. She goes, oh, I don't want to drink out of your soda. And this was early on, and I go, what are you talking about? She goes, oh, gay guys are dying from this virus. They didn't call it a virus, they called it this cancer. And so, it was called gay cancer. And then the one thing I do notice, to be quite frank, we never had safe sex. And they were saying, okay, they started putting condoms out, now you have to have condoms for sex. And that was like, I never heard of that, and so that was something totally new. And I remember that, it's like, oh wow, and I went to a big event and I made a joke about, you know, I hate safe sex. It's like getting a candy bar, not being able to take the wrapper off. And that was like in '85 at the Echo's Reader's Choice Awards, and people were like, oh, it's so controversial. But it was a joke. And still kind of funny, I think.
It's still close to the room.
And then, like I said earlier, our little information was our little 2 or 3 page paper. Well, what we started seeing was these papers were getting thicker. They were full of obituaries. And that's how we knew it was in Phoenix. Nobody said, hey, I've got AIDS. You just started reading about it. And people started, quite frankly, just kind of like dropping. And it was unknown. You didn't know, is this going to last a few years? Is this going to last a lifetime? It was just the unknown. And of course, people were in denial. People were freaking out. There was a lot of suicides. A very good friend of mine in Cottonwood, he was only 30-something. He was a Vietnam vet. He owned a restaurant in Cottonwood. He found out, he went down and shot himself. A couple other friends of mine couldn't face the facts and killed themselves. And because we didn't know, is there going to be a cure? Is there, you know, they didn't honestly even know how it was being transmitted. It took a while to pinpoint that. So people were like, I don't want to use your straw. I remember going to the thing at the 307 and I was going to borrow someone's lip gloss and they go, no, don't use her lip gloss. So, you know, thankfully, as it went on, we learned different things, but it was almost like hysteria. Couldn't tell anybody because you could lose your job, you could lose your insurance, you couldn't get time, you know, you couldn't get anything. Some healthcare, some like doctors didn't want to see people with it. Some hair salons wouldn't let you go in. Nobody wanted to work. I remember when they started wearing the rubber gloves when you go, you know, and I was like offended the first time someone put on rubber gloves to give me a manicure or pedicure because they didn't just want to touch you. Arizona Rodeo Association started about that time in the mid-'80s, and I remember they brought in the singing group, the Kendalls. It was a mother and daughter country group. And that Jeannie Kendall, at the end, they went up to give her some roses, but she wouldn't take them from the guy because she was afraid she'd get AIDS from taking some flowers. It sounds crazy, but that's the way it was.
That was the hysteria.
Yeah, and you know, it's like, it was just crazy. And the one benefit I do remember very early, Charlie's had just opened at the second location, and it was very new. They had started this little feeding program, Joshua Tree, where they were cooking lunch for people 1 day a week on a Wednesday, so people that could go get a meal. Because people back then, it seems like it went so fast, you wouldn't even diagnose, you'd just be sick, and you went downhill fast and couldn't work. You know, I don't know if it was just that early onslaught. I don't know. It just seems like now, you know, I don't know, medical care is different or something. But anyway, they asked me to do a fundraiser for Charlie's. The Charlie's never do drag shows. And they decided to do this one. And so it was from Joshua Tree, and they had asked me to host it. And all they wanted was $25 to get a crock pot. And if you know anything about Joshua Tree today, how much they've grown up and come in, they actually provide meals every day, I believe, in delivery and stuff. But just wanted a crock pot just to be able to feed people. And
do you recall how much money you raised that first
I
fundraiser?
don't remember, but we did more. We got a couple crock pots. And that was one thing. People did, you know, a lot of us didn't have money back then, but I never heard anybody say, no, I won't come out and help. I'll do what I can. You know, we were a much tighter knit entertainment community back then, and we did work in a lot of places. Believe it or not, there was just a handful of working drag queens. Some call it the good old days. I'm one of them.
Yeah.
And, but I never, you know, saw people really come out. And then you started seeing people living with it. And I know people who years, and people surviving. And they called me a couple of years ago from the ASU and said, we want to interview gay men in their 50s that had had sex, that survived the AIDS crisis. And I thought, wow, I was a survivor. I'm HIV negative, by the way, and by the grace of God, I don't know how that happened. At one service one time, I won't mention the person that I was at a service for, but someone came up and said, I don't know why this person died. People like you should be dying. And who knows? Who knows? There's, knock on wood, but for the grace of God. So I have many memories throughout the whole years of losing friends. I don't even remember my first friend. I think a couple of entertainers didn't pass away. I remember Woo. I was working at Sticks then. But I think people as a community kind of went through that disbelief, shock, anger. I had an encounter with someone and they got mad at me for some reason and said, well, I just gave you AIDS because we just had sex.
Is people who are at risk of getting HIV, especially young and MSM, African American MSM. That's a very high risk. MSM. Yeah. If you're born and who you are African American MSM, the chance of getting HIV in your life is 50%. That's not acceptable. If you are a Latino MSM, the chance is 1 in 6. So those.
And what is MSM?
Oh, men having sex with men. Then so we need to do a lot more education to people who are at risk of getting HIV. The other education we need to do is we need to educate the community in general that being HIV, having HIV, it's just having a chronic disease, and people can live and have a normal life and cannot transmit the virus.
What changes have you seen in the government from, again, those early days till now?
We have come a lot, and right now, I think with the model of Fast Track Cities Initiative, which is a 90-90-90-0.
And can you explain that?
Okay, so the UNAIDS started this Fast Track Cities Initiative in 2014. And their model is that if 90% of the people know their status, 90% of people who are tested positive get on HIV medications, and the last goal is 90% of people on medications are undetectable, you can actually reduce the newly diagnosed rate by 50% in a few years. And our goal is to do that by 2020, which is next year. So we're not going to reach that goal, but we can do that by 2030. Now the last zero in the 90-90-90 is a zero stigma. And actually that should be the first one before 90, because if stigma is in the front, in the back, no one is gonna come and get tested. So we need to bring the zero stigma to the front, get rid of the stigma, and get people to come and get tested.
I just believe that everyone has a role to play in this fight against HIV and preventing new infections, whether you're positive or not. It's important that you get educated, and if you're positive, just keep taking your medicine and do what you have to do to stay healthy. And if you're negative, take those extra steps that you can take in order to stay HIV negative. So everybody has a small part to play in it.
I think, like I said, there's still work to be done. I think there's a lot of people who still view HIV with that stigma of like the early 80s. So I think I think society is still, I mean, even my own education, educating other people about HIV, hearing that like, oh, it's still around, oh, it's still a thing. No, it's still a thing, and it's still affecting people every single day. So when I hear comments like that, it upsets me, because people they're not getting the education. They don't know, they think that, oh, that was passed in the 80s, but no, it's still affecting people every day. So there's still work to be done,
Right.
as far as society.
And what do you think the future of HIV and AIDS is?
Hope. I think the future is hope. I think it's a place where we can get to, stronger medication, more prevention tools, and then, one day a cure. And I know and I know in my heart that's going to be in our lifetime, but there's still work to be done to be able to get there.
A lot has changed in the last 10 years, and I think that a lot is going to change in the next 10 years. I think it's hard for me to envision treatment getting much better. I mean, maybe there will be a suppository, maybe there will be an implant, maybe there will be other delivery methods of the HIV medication to suppress viral replication. But right now, I mean, one pill once a day is pretty easy. And so, I mean, it doesn't get a whole lot easier than that. So I think the next decade we'll see further developments in a vaccine, and I think we'll see further developments in a cure. And I do believe that we are going to see the development of a vaccine and a cure in our lifetimes. There's sufficient research underway now, clinical trials, human clinical trials of vaccines, and a lot of money being thrown into cure technology using CRISPR technology. So I genuinely believe, for the first time in forever, really, that we're living in a moment that we're going to see an end to the HIV epidemic, hopefully within the next decade.
I am HIV positive. So back when I moved here in 2010, I didn't know necessarily what I wanted to do. I knew I wanted to go to school and work and figure life out. So I had about a month here, and I started volunteering at which basically is Phoenix Pride now, but it was called One Voice Community Center then. And I volunteered with them, and they were offering free HIV testing. I had not been tested before, so I decided, hey, I'm new to the city, might as well find out and have a clean slate and start off fresh and new. So my first HIV test turned out to be reactive, and I got my positive diagnosis back in 2010.
When did you first hear about HIV/AIDS?
I mean, we covered it back in probably high school. I remember there was maybe in health class, we didn't really discuss much of health, and we definitely didn't discuss much of HIV and STDs. So it was basically glossed over in high school, and I remember hearing about it then and not really paying it too much mind. It was just one of those things that wasn't prominent in my life, so I'd never really thought of it. And it was maybe in a movie, watching Rent, I'm like, oh, HIV, okay, it exists. And that's pretty much it.
So since that time, what have you seen change in you?
I mean, I was 21 when I was diagnosed. I'm 31 now, so I think a lifetime of change. I think I found direction in life. It wasn't the best thing to happen to someone. I mean, who would want to find out a life-changing thing like this? But I think it really helped me in giving me a direction. I came up to Phoenix to find direction, and HIV kind of led me to it, and it brought out a passion in me, and it made me feel really connected to a cause that I just wanted to help and educate, because I was so ill-educated on this, and I figured, you know what, well, I want to make sure that people understand what HIV is and how you can and how you can't get it, because there's so much misinformation out there. So I really find that I found my passion with it.
So what changes have you seen in society?
I'm a social worker and I work in the field, and I'd like to say that there's progress, but with every bit of progress you see a lot of backsteps and people saying horrible and doing horrible things. And I think that as a society we've made some strides in the sense that it's becoming more visible and talked about. I feel like with television and movies, I feel like there's more exposure to queer characters and trans characters and anybody under the spectrum of the LGBT community. There's more visibility being shown, and with that visibility, people are able to share their stories, and HIV is a huge part of what our community's been through. So that has shed the light, and I feel like there's been, I mean, at least more curiosity from people, and kind of my hopes would be that they're educating themselves a little more.
And have you seen a change in the knowledge out there or the education that's going on?
Yes, I do know that being that we're living in the time that we're living in and the technology that we have, there's more studies and research going on behind it. So with the with that information, we're able to see how miseducated people are. So I think that the people who really want to make it their mission to teach people, they're really making things happen and wanting to be part of their communities, like Ripple Phoenix. I mean, we have a community outreach group that is out there and making sure that people are aware and having the conversations that are so needed so that we can find out what the virus is and how to protect ourselves and what to do if we do find out we're positive.
And what about treatment? Have you noticed changes in treatment for folks?
Yes, I'm so thankful that PrEP is finally being talked about in a wider setting. I know that it's been proven in bigger cities like San Francisco and New York that, I mean, they've been pushing PrEP and also giving PrEP to people, and they've seen people doing so well and the rates of transmission decreasing so much. So I think it's just a matter of time with getting the word out there with that form of treatment. It's not only just condoms anymore. We have the tools such as PrEP and treatment as prevention. I mean, people need to also understand that an HIV positive person taking their medication is a form of protection as well. I think that that's something that's very, I mean, you equals you, the message is out there. There's studies, there's research, there's facts out there. So I just think people need to be a little more open-minded and willing to educate themselves to find out, hey, you know what? There's different options out there for us.
What do you think the future of HIV/AIDS is?
I would hope that there's a cure out there soon. I mean, I think it's amazing that there's all these advancements with treatment as prevention and with PrEP. I would hope that with all these advancements that we're taking, a vaccine is out there, and that hopefully we could see it in our lifetime. I think it would be fantastic if I could see it. I hope that it's in my lifetime, but I do believe that there will be an end to this virus someday.
And is there anything else you'd like to add to the conversation?
I can't stress education enough. I feel like if people really were educated on this topic, it wouldn't be so stigmatized. I think that stigma is the #1 killer for this virus. People are afraid to talk about it and seek out the information. It's a scary thing to hear that you're HIV positive and that your life's gonna change. Any sort of illness is scary. And I think that HIV is one that has such a negative stigma upon it, and I wish that people would change their way of thinking and really educate and understand what it is and have a little more compassion.
So when I was going through my list of questions with Glenn from Aunt Rita's, one of the things he brought up is, especially folks with HIV, he was asked the question, would you go back and change your status? And so I posed that question to you.
No, I don't think I would. I honestly feel like this was meant to happen. I don't know, I think, let me rephrase that. I think that this happening to me was something that really, again, helped me find a purpose and a passion, and I'm thankful for that. And I'm living a perfectly healthy and normal life. So it's not costing me anything, it's just me reminding myself to take a pill every day and making sure I'm taking care of myself so that I can take care of myself and others. So if this is the cost of me being able to do something I'm so passionate about and being able to educate other people, I wouldn't change it.
Very good. Thank you so much, Noah. If you could take a pill and cure yourself of AIDS, would you?
Yeah, absolutely, I would. And having said that, I don't long for that. I want to be healthy and I want to be happy. The fact is, I am healthy and I am happy. So that's really the more important thing. But if I could take a pill and cure myself of HIV, absolutely I would take it. But I have no problems taking a pill the rest of my life to treat my HIV and let me continue the lifestyle that I currently have, which is wonderful. So I'm not bemoaning my current fate, but would I cure myself of it? Absolutely, yeah, sure. I think anybody would. At the same time, it just deserves acknowledgement that, you know, to celebrate the healthy lives that people are able to live with HIV today. And I certainly would not eliminate the experiences that I've had along the way. I cherish the people who I've met in the last 20 years of my own experience living with HIV. I cherish the relationships that I've developed. I've met my partner since that time at a HIV stop smoking class. So I mean, I've met so many individuals and I've had so many amazing experiences. So I wouldn't take this away. So if someone asked me if I could take it all away and go back in time, I certainly would not. But at this point going forward, yes, I would.
Anything else you'd like to add?
The only thing I really want to add, which I've sort of said before, is just, you know, this problem of stigma in our society. It isn't just related to HIV. I mean, there's stigma around mental health issues, there's stigma around sex, there's stigma around so many things in our lives that are so incredibly normal. I really hope that one day people get the fuck over it. I really do, because that's just really what needs to happen.
Thank you.
I don't remember exactly, but I'm thinking maybe Ryan White is probably when I heard about HIV and AIDS. I don't know how old I would have been, and I don't think I necessarily understood it all. And I feel like I'm in this weird age where I didn't necessarily have friends that died from HIV or from AIDS rather, but I do remember it. So I think that's probably when I first heard about it.
Okay.
I remember in elementary school, like they did the circle, circle, dot, dot. Now you have your cootie shot, and it became like now you have your AIDS shot, and that was kind of my first recollection of it. And I mean, I had no real understanding of it, but I remember like that kind of framed it for me, as far as like kind of setting the stigma back then.
Wow.
I know, like rough. But that was like, it was, now you have your AIDS shot. And, but I think like I didn't kind of connect the dots of how you get it, or like people like in my community getting it until I was in my early 20s. Yeah, I met one of my stock. I worked at Michael's at the time. One of my stock employees. One day I went over his house and some boyfriend had just left me, bastard. And so I went over all upset. And he said, "At least you don't have to start dating when you have HIV." And so.
Cut.
Hey.
Hello.
Come on in.
We are recording right now.
No, come on in. So he said, at least you don't have to start get out there and start dating when you have HIV. And I didn't realize that he and his partner were in a mixed status relationship back then, and this was late '90s. And like that day, I think I realized what love was. They were married, they were together. His partner was fearless about HIV, and he said, "We have sex with condoms. Like, it's so good sex." And I remember he had this thick, like a Cuban accent, and he just like, "It's still good sex." And it was, and I believed him. Yeah, it was, it was good stuff. I just recently reconnected with him on Facebook. I honestly thought he had passed away, and I'm so glad. I'm so glad he didn't. He's not with the hunky Cuban though. Yeah.
So you mentioned the whole idea of be the change.
Yeah.
So what changes have you seen since your turmoil till now?
It's interesting, like when we go out, I think we've talked about this, that in the last couple of years, we encountered more people who disclose their status to us when we're going through the bars. So we push this cart aerial around with us and talk to people about like PrEP. Like, do you know about PrEP? Have you heard about PrEP? And a lot of times people will say, "Oh, it's like I don't need it. I'm already HIV positive." And so I think we see more people kind of opening up and having that conversation, which is beautiful that we're able to do that.
Right, which we hadn't seen maybe when we kind of first started doing some outreach and so forth. And it's really cool to see that. And it's also cool I'll disclose my status sometimes, and if we're talking about something, and I'll say, "Oh, by the way, like I'm HIV positive, or I take this medication," or just something along those lines. And I think that reaction has definitely, one, it's been a growing experience for me, but it's also, I think, it's changed, it's evolved over the years. So
Jason's even changed throughout, because when I first started working at Southwest Center, we went to the gay rodeo. And that was our first outreach event. We had the condom bar with Ignite, and it was our very first event. And we had this like argument, like where you like grit your teeth and like kind of whisper argue, like in the middle, in public, like get back here. And he was like, "I can't do it. I can't do this. I can't hand out condoms. I'm HIV positive. I can't do this." And to today, he's walking around talking with people about his status, and I think. Like we've all kind of blossomed too along the years. Like we've seen volunteers blossom and kind of find.
Yeah, it's been great to see.
path.
Yeah, volunteers, the community, just so many people just kind of go from maybe this place to this place, and we're all at different timetables. Like me, it took years to become. Even when he was doing this work, I mean, he was publicly doing this work, and technically, I was still in the closet about my status. And even though he's out there day after day talking about HIV, it was like too much because it was just everywhere, and it's still everywhere now, but I'm glad it is. Like, I'm glad we're doing what we're doing.
And then, so you talked about changes in you, changes in kind of the community. Have you seen changes in terms of treatment as well, or even government? I mean, how that government responds to?
Yeah, that's not true. So yes, treatment is it's ongoing. It's continually evolving. I think like people in the '90s, I originally, once I had my first friend who told me he was HIV positive, I started volunteering at a hospice, and this is when people were still dying, and so seeing how sick the medications made people then, they were overdosing people. It was too much medication, and to now where they're really tweaking it to find the minimal amount of medication that you need to still be effective, and seeing that how that medication is so effective it makes the virus become undetectable. And so just that whole the science behind undetectable, meaning someone can't transmit the virus if they're in treatment, is beautiful. I mean, that was never something I imagined back in the 90s that would even be possible. But getting to that undetectable level is, I mean, you're keeping yourself healthy.
Correct. I'm taking responsibility myself, and again, as long as I take my medication, then there's no way for me to pass the virus on to someone else. And someone that's HIV negative, again, another tool, PrEP, you know, and as long as they take their you know, if you're HIV negative and you're on PrEP and you're taking that medication every day, then there's no way for you to contract the virus. And it's just like, wow, we have these two amazing, you know, tools. That's kind of the HIV neutral term, or whether you're HIV positive, HIV negative, we all have the tools to help with the epidemic. So.
Like, we have the tools today to stop this virus from spreading.
Well, and that's a great thing into the almost the final question. So, what do you think the future of HIV/AIDS is?
I hope we're rolling around with our little outreach cart, getting people vaccines or cures or whatever. Like, that would be the dream. We'll keep rolling.
Yeah.
Until we do.
Yeah. I think it's amazing, like how far we've come already, and I'm sure there's something out there, and it's unfortunately, you know, the red tape and kind of getting it through FDA and all that neat stuff, but I think there will be something out there in our lifetime.
We went to a biomedical conference last week, and it showed talked about vaccines, and that how long it took for like just the flu vaccine to be developed, and how many, like, it takes decades typically for for a vaccine to be developed around a virus. So kind of the point of that was that it feels like an eternity to us. It's been a lifetime for us, but that work is still being done. They're still very optimistic about it, but it's a time thing. Yeah. So, but I think we'll definitely see a vaccine, which is amazeballs.
In closing, anything else you guys would like to add?
I think, like, for me, like when Jason was diagnosed, like kind of within the week, I went to kiss him and he said, "I feel toxic," and like that's always kind of stuck with me. And I think the message that's important for me to get out is to go find love, because HIV isn't a death sentence. It isn't. You can live a long and happy life, and everyone should be able to go find love, and without letting status get in the way of that.
And that's what I learned from Jeremy, learned from our outreach, learned from our volunteers, where my coming out process, Jeremy was a huge part of that, but so was our community a huge part of that. And I couldn't have kind of done that, and I feel now that I am in a, we are fortunate to have Ripple, to have, you know, to be able to do some of these things, and I think I enjoy kind of giving back, and enjoy talking to our community about it, because we have some really good, it may seem at times we're having these 1-minute conversations, but it's amazing what some of these 1-minute conversations are with people.
Yeah, it's good stuff.
All right, thank you guys.
Okay, thank you. Hey, mister.
You know, it's almost, we are going back in time. You know, back when we didn't have any medications, the community, the gay community, the people with HIV community, they all came together and became an activist and talk about it, and, you know, talk about, we are HIV positive, we need medications, and now people can live with HIV without, you know, having to fight for anything. You know, it's hard to explain, but I think when you don't talk about it, you make a stigma worse.